adverse drug reactions have a significant impact on public health, both in terms of human health as they cause a huge number of hospitalizations or even deaths, but also in terms of cost. However, a big percentage of adverse drug reactions are preventable. Consequently, there is a growing need to develop tools that assist in adverse drug reactions detection and management in a timely and efficient way. Pharmacovigilance, also known as PV, is defined as the science and activities relating to the detection, assessment, understanding, and prevention of adverse drug effects or any other drug-related problem. The identification and confirmation of new or incompletely documented adverse drug reactions, usually referred as signals, requires collecting and analyzing data from multiple data sources. Typically, this process entails the detailed analysis of individual case safety reports submitted by patients or doctors via spontaneous report systems, also known as yellow card systems. The identification and confirmation of adverse drug reaction signals is carried out by PV professionals and expert groups based on the assessment of the benefit-risk ratio for using the drugs in question, according to all the available scientific evidence. Moreover, the management of potential adverse drug reactions and relevant signals is of the utmost importance for clinical practice and healthcare in general. The PVClinical project builds an online platform that supports the analysis of data, which could support the investigation of potential adverse drug reaction signals via the integration of multiple heterogeneous data sources in one gateway. To this end, the user defines a scenario based on a drug-event combination, and knowledge engineering is used in the background to expand the search space, using well-defined terminologies and ontologies, namely ATC for drugs and MEDRA for adverse events. More specifically, PVClinical platform functionality is organized in 4 workspaces to service the particular needs of each data source per se. OpenFDA Workspace is presenting statistical metrics for signal detection and individual case reports provided freely by the FDA, collected via the US-based spontaneous report system named FAIRS. Odyssey Workspace is offered the capacity to integrate data for adverse drug reactions from electronic health records, observational healthcare data, insurance claim data, etc., based on the OMOP-CDM data model and the tools provided by the Odyssey Initiative community. PubMed Workspace provides a portal to literature relevant to the specific potential drug-event combination under investigation. Twitter Workspace is facilitating the analysis of user-generated social media data to support the investigation of specific adverse drug reactions. But let's see PVClinical platform in action at clinical environment. This is Dr. Riley. Dr. Riley is a medical doctor that works at the oncology department of her city's hospital. And this is Mr. Jones. Mr. Jones is 65 years old. He is an accountant and one of Dr. Riley's patients. He was diagnosed a month ago with a blood malignancy, so Dr. Riley prescribed him an oral chemotherapy medication. Mr. Jones loves walking to the countryside, so he is planning mini trips almost every weekend. But after a month of daily medication treatment, he observed a shortness of breath and dizziness when finishing his walking trips. This morning, Mr. Jones felt a chest pain when he woke up. He was really concerned and called Dr. Riley to mention the event. Dr. Riley advised Mr. Jones to visit her at the hospital for further examination of the event. Dr. Riley is afraid that these symptoms are related with a potential cardiotoxicity effect, and as she recalls, a similar condition was observed with another one of her patients a few weeks ago. So she decided to investigate the potential signal from drug substance further with PVClinical. Dr. Riley signs a PVClinical platform. The dashboard with all her saved adverse drug reaction investigation scenarios show up, and she creates a new adverse drug reaction investigation scenario. At the Add Scenario page, she defines the drug event combination to be investigated. After saving the scenario, she can select one of the available workspaces to navigate to, using the orange button. Dr. Riley begins the data exploration using OpenFDA Workspace. Here there is a drop-down frame with disproportionality analysis statistic measures, based on the individual case safety reports collected by FDA. In Quick View tab, she gets an overview of the importance and the frequency of the signal through an interactive time series graph. Once Dr. Riley confirms the importance of the adverse drug reaction, she decides to investigate further the data collected in her own hospital's data warehouse. As Mr. Jones suffers from cardiac failure and he is over 50 years old, it's essential for her to confirm if this potential adverse drug reaction is somehow related with his specific sex and age category. For this purpose, she uses the Odyssey workspace, where a quick view and a detailed view for further investigation are available. Dr. Riley selects the quick view. Here there are two choices in the first page. Incidence rate is a measure of the frequency with which some event, such as a disease or other incidents, occurs over a specified time period. Cohort characterization is defined as the process of generating cohort-level descriptive summary statistics from person-level covariate data. She clicks on the incidence rate, which enables several data filters to specify the search criteria. Dr. Riley selects the age range that she is interested in and the gender to explore the respective data. After these procedures, Dr. Riley concludes that cardiotoxicity is indeed a very probable cause of Mr. Jones's symptoms and refers him to a cardiologist with whom she collaborates. Now let's see the use of PVClinical Platform from a drug safety professional scope. This is Dr. Eliza. Dr. Eliza is a PV expert in a drug safety monitoring organization, and his study is about the potential signal of cardiac failure caused from the same drug. He starts his research for the drug event combination by the OpenFDA workspace, where he collects information about the values of main statistical metrics that could possibly imply the significance of the potential adverse drug reaction signal. Dr. Eliza also wants to know the values of proportional reporting ratio, also known as PRR, and reporting odds ratio, also known as ROR, of the signal observed through the previous year. So he checks the Dynamic PRR tab view in OpenFDA Workspace to examine the longitudinal graph of PRR metric. Before leaving the OpenFDA Workspace, he also clicks on the Report View tab to drill down on the respective individual case safety reports and notes, looking for potentially interesting details about the concomitant drugs, the dosage of the drug, and the severity of the adverse drug reaction. Once Dr. Eliza gathers the main information about the seriousness of the investigated signal, he examines the existing bibliography of the PubMed workspace of PVClinical Platform. In this workspace, he evaluates the relevance of the specific papers with his research and can also take notes. As he explores data, he realizes that according to OpenFDA, individual cases and PubMed-relevant literature, cardiac failure is identified more frequently in men than in women. This leads Dr. Eliza to Odyssey Workspace. In this workspace, he validates this observation by using clinical data that came from hospitals and through the incidence rate analysis view. Additionally, Dr. Eliza wants to investigate the potential impact of concomitant drugs, and thus he checks both information from OpenFDA data but also data from the cohort characterization view of the Odyssey workspace. But that's not all. PVClinical offers Twitter Workspace too. So let's say that Dr. Eliza wants to investigate if there are social media trends potentially referring to the respective adverse drug reaction. In Twitter Workspace, he can view the fluctuation of people's tweets through time. PVClinical Platform is a unified gateway integrating large-scale heterogeneous information sources, Typically, these sources have so far been used fragmentarily or not used at all. These emerging data sources could hopefully facilitate adverse drug reaction management, ultimately leading to safer medicines and better healthcare.